So my name is Tung, and I'm one of the senior clinical research practitioners at the Non-Malignant Haematology Clinical Trials Unit here at Hammersmith Hospital.
It's a pleasure today to be here at Hammersmith Hospital, visiting the research lab for Professor Nicola Cooper and a wonderful team here. And we're here as well, talking to the research people here about all the trials that are being undertaken for ITP. And if you could just, give us a background to some of the trials that you're involved with at the moment.
Portfolio here and the non-malignant, we have quite a few ITP clinical trials for adults here at Hammersmith. So one of them, we have two trials that are being run by Takeda. And this is we have a double blind and an open label. Patients who are eligible to take part in the phase 3 double blind trial where it's placebo controlled. So this is looking at a medication called mezagitamab, and it's an anti-CD38 treatment. And patients can be on placebo or the mezagitamab.
Easy for you to say.
Yeah, there's a two-thirds chance, 66% chance you get the medication, and a third that you get placebo. And it's a 24-week trial. It's quite a short trial. At week 16, you're given the option to move to their sister trial. If they're not responding, they can move on to their other trial. And on that trial, you definitely get the medication. And that one as well is weekly for 8 weeks. It's a regular injection, subcutaneous injection. And we review the patient quite thoroughly every week.
How many patients have you got involved in that?
So we've had 3 patients on this trial here at Hammersmith. We had the first in Europe and UK. And we've carried them through.
I can remember that actually, when that happened. Because Takeda were very, very impressed with it.
Yeah, it was a big celebration.
Yeah.
But it meant that we managed to get treatment early to our patients, so they can have access to newer treatments early, as well as we having the first patient can get it to patients sooner. And we've had 3 patients on that trial, and 2 of them have moved on to the open label where they definitely get the drug. And we've just the third one we've started last week, actually. So we still continue activity on that. And that's been open since last year.
Superb stuff. And the timescales for that, because I know these trials take a long time. If you could just give us a flavour of how long, potentially these trials can take.
The length for the patient's about 24 weeks. But the trial is open. So we have global competitive recruitment. So they have a target of how many patients they want worldwide. I think this trial is around 130. So once they've hit the full numbers worldwide, they will close the trial and analyze the data from all the sites, and they'll review whether the drug is effective.
Okay. So effectively, once you get the cohort that they want up to 130 patients, that's when they close the trial. And
that's when it closes. So all trials, they have to meet a global recruitment cap, and then throughout the trial, they will review the data, but at the end, that's when they get all the sites and all the data, and they'll review whether it's worth going ahead with it.
Yeah. Mentioned the Takeda trial.
So we have 2 Takeda trials. We also running the Argenx trial. This is looking at efgartigimod, which is a FcRn inhibitor. This one is an infusion that we potentially could be doing every 24 weeks, a bit more intensive. It's a 1-hour infusion. We haven't had anyone here at Hammersmith. I think we've had one in the UK, and this one, because of the time it takes, so maybe 24 weeks straight, could be quite a burden, that trial. But we're actively looking for someone on that trial at the moment here at Hammersmith.
Yeah, was the one in the UK?
I think that was in Barts, that one.
Was it Barts?
Yeah.
Okay. What about other ones?
So we currently have another active one done by Pfizer, and that one, they don't have an actual name for that one. It's a bunch of letters and codes. That one is open label, and it's phase 2. So it's mainly looking at the safety of this subcutaneous injection. And that one they receive once a month for 4 times. And we've had 2 patients here at Hammersmith, also the first in UK as well. We've had 1 patient who's just finished the whole trial. It's a short trial, 28 weeks. And we've had 1 on trial who's had their second dose not long ago. So that one's also subcutaneous injection like Takeda.
Yeah, good stuff.
That one's still open and active.
Any others at all?
Those 4 are main ones at the moment.
That's the 4 main ones.
Interventional and commercial.
Okay. Have you noticed with these trials, there's a move now to do rather than weekly the medication, like going to the monthly to try and
make
it easier for the patient?
We would like to reduce the burden of all these treatments. We want to make treatment that works, but also treatment that's feasible to patients in the everyday world.
Yeah,
every day.
yeah. And
So-
help with their quality of life, of course, as well. Yeah.
Even though they're weekly infusions are one of the longer treatments compared to like an oral tablet or an subcutaneous injection. So
Okay.
we're always seeking ways to improve the quality of life for a patient, whether it's the actual treatment itself or the regimen of the treatment.
Novartis got anything going on at the moment?
At the moment, we had quite a lot of Novartis trials back in 2023, 2025. They stopped recruiting. We still have the patients in long-term follow-ups. I mentioned some trials are 24 weeks. This one has been going on for 2 to 3 years, actually.
Okay.
So those ones were, the Novartis ones we had were the ianalumab. We had 4 of those trials looking at different phases of ITP, of disease progression. So we had one with first-line patients who have just been newly diagnosed within 28 days to get them on the ianalumab. And we had patients who second line who failed like steroids, first line therapy. And we had one for refractory patients who failed multiple lines. And that one was open label, whereas the other ones were double blinded. And we've just opened the 5th one the 4th one was for warm autoimmune hemolytic anemia patients. And we've just opened a 5th one for patients who responded to any of the ianalumab in any of those 4 trials who took part.
Okay.
So it's given them an option to have retreatment if they relapsed for patients that showed some sort of response on the original trials. I've been running and delivering the ITP trials since I've been starting, really, over 3 years ago.
Well, thank you for what you've been doing.